So, Mr. Haldar, hello and a very warm welcome to Top Doctor's latest interview with one of our leading UK consultants. And today, to mark this year's Men's Health Awareness Month, Movember 2021, we're going to talk to a consultant urological surgeon, Mr. Neil Haldar, with regards to prostate cancer. So, before we get into the questions, then, Mr. Haldar, if you want to maybe briefly introduce yourself, your areas of expertise, and your field, your specific field.
Thank you, Connor. I'm very happy to be here and to be interviewed today, and for a great cause in supporting Movember and men's health. So I'm, as you mentioned, a consultant urologist. I work mostly in the Buckinghamshire, Oxfordshire area, and have been a consultant urologist now for 16 years and counting. My area of expertise is mainly in what we call uro-oncology, which is cancer surgery. So that's renal cancer, prostate cancer, bladder cancer, testicular cancer. So they're the main areas of speciality.
Fantastic. And I suppose prostate cancer, it's such a prevalent topic, and it's a condition that affects hundreds and thousands of men worldwide. So this month is really, really important to raise awareness about the topic.
Absolutely. Yeah, absolutely.
Fantastic. So, Mr. Haldar, thank you so much for that. And well, the first question then for you with regards to prostate cancer, are some men more likely to be diagnosed with prostate cancer? And if so, what are the contributing factors to this?
Sure. Well, about 1 in 8 men will be diagnosed with prostate cancer in their lifetime, or 1 in 8 risk. So as you mentioned, it is extremely common, but there do seem to be some risk factors that make it more likely that a man would be diagnosed with prostate cancer than others. Certainly, the biggest risk factor appears to be age, and the older you are, the higher the risk of developing prostate cancer. And about a third of prostate cancers are diagnosed in men over the age of 75. So certainly age increases your risk. The other factor that seems to increase your risk is having a family history of cancer, and specifically prostate cancer or breast cancer. And if you have a first degree relative, for example, a brother, father, or indeed mother with breast cancer, that seems to increase your risk of developing prostate cancer by about 2-fold. The third risk seems to be ethnicity, and there are some ethnic groups that have a higher risk of developing prostate cancer. So men of Afro-Caribbean origin would have a higher risk, then seem to have a double the risk than those of a Caucasian origin. Geography seems to play a role, so we know that risk rates of prostate cancer are much higher in North America, Europe, and Australasia, whereas in Asia, Africa, they seem to have a lower risk. That may be environmental, but probably more related to levels of diet, and what we come on to as the next risk factor, which seems to be obesity. And there seems to be an increasing trend in diagnosing prostate cancer in obese men, and it may be one of the reasons that prostate cancer incidence seems to be going up. So they seem to be the main risk factors that make people more likely to be diagnosed.
Okay, very interesting about obesity there. You touched on, Mr. Haldar, so people can maybe be more aware about how to improve their lifestyle perhaps, and their lifestyle habits in terms of reducing the chances of getting diagnosed.
Yeah, absolutely, Connor. So if that list I gave you of factors that increase your risk of developing prostate cancer, age, family history, ethnicity, those are not factors that we can reverse or modify. We can't change our age. We can't alter our genetics.
Yeah.
Or our ethnicity, but the one factor that we can change is our level of obesity, and so that there seems to be increasing evidence that if you exercise, modify your diet, reduce alcohol intake, and reduce your meat intake or red meat intake, specifically processed meats, then you might be able to modify your risk that way. But of all the factors that we can modify, that's realistically the only one, and it's worth working on.
Absolutely. Fantastic, Mr. Haldar. A very good expert advice there for patients to be aware of, for sure. Then leading on to our second question then, Mr. Haldar, how exactly is prostate cancer diagnosed?
Well, in the majority of men, a patient would be presenting to their GP either with symptoms, so they notice a change in the way they pass urine, either becoming more frequent, possibly more urgent, or reduced strength of the flow, reduced pressure. That doesn't necessarily mean that they've got prostate cancer, but they may be presenting to the GP with that. And then the GP would normally examine their prostate and often do a blood test looking for prostate cancer called a PSA blood test. Again, neither of those are create a diagnosis, but if your PSA blood test is elevated, it just sends a warning in that you possibly have an increased risk of having prostate cancer. And equally, if on the examination of the prostate there's a degree of suspicion from the doctor, that doesn't mean a patient has prostate cancer, but it increases the suspicion. Or a patient may present to their GP just as a well-man check, a health check, and as part of that health check, the GP or practitioner may do a PSA blood test and a rectal examination. But if on the PSA blood test there's a degree of suspicion, or on the rectal examination of the prostate there's a degree of suspicion, then that might move patients on to further diagnostic tests. And the two main ones really are an MRI scan of the prostate, and these days with various techniques, improvements in techniques, specifically multiparametric MRI scanning, we're becoming much better at identifying prostate cancer. And if the MRI scan was suspicious, or if the blood test and the rectal examination was highly suspicious, then that would probably direct men towards having a biopsy of the prostate. So biopsies of the prostate, usually done under local anesthetic, don't take too long to do, and it really involves having a needle inserted into the prostate, taking a very tiny little sample, usually mapping out the various zones of the prostate, and then those tiny samples are sent to a pathologist. He would look under a microscope to see if there were actually prostate cancer cells in those samples, and that's the definitive way of making a diagnosis.
Very, very thorough, for sure. So very, very effective way to actually diagnose it, very trustworthy manner. So that is very, very good to know for patients, that they will be diagnosed in a correct and thorough manner.
Absolutely.
Excellent, Mr. Haldar. So our third question then for you today, what should men be aware of in terms of lifestyle factors that may affect their chances of being diagnosed? You touched on it. What should they really be aware of this month and, well, throughout their life span to really improve their chances of not being diagnosed?
So absolutely. So I think we've touched on the factors that are reversible, and realistically, the only real factor is lifestyle. So it's making sure, in terms of obesity, it's not just whether you're overweight. It's the evidence suggests it's more your fat to protein ratio. So the fitter you are, the more muscle you have, and the less fat you have, that seems to play a role. And dietary issues, although the evidence is mixed, and it's very hard to pinpoint one part of your diet from another in contributing. It does appear that a diet that's high in animal protein, particularly red meats and dairy products, seems to increase your risk over vegetable protein. And possibly alcohol and smoking play a role, but it's not clear-cut evidence. And then the other thing that's reversible is really your ability to get yourself checked out. So if you have symptoms, or if you're worried, then absolutely go and get checked out with your GP, and that's absolutely within your control, whereas many other things aren't within our control.
Absolutely. And you touched on it there, Mr. Haldar, leading us right into the next question. When should men really seek immediate medical attention with regards to some warning signs that they might be worried about, or potential symptoms? When should they really seek medical help?
Yeah, the important thing to know is that most symptoms that men get from their waterworks for passing urine are usually not due to prostate cancer. Most of them will just be due to an enlarged prostate, which is much more common, or having an irritative bladder. And so there are many reasons to have developed symptoms of your from passing urine, but prostate cancer is potentially one of those. So it's always sensible to get checked out if you notice a change. And the main changes people seem to notice are increase in frequency, getting up at night more often, passing urine with less pressure, possibly taking a while to get started and having to strain to get started, and sometimes feeling that they haven't really emptied their bladder when they go. So the urine flow stops and starts, and then a few minutes later they feel that they need to go again. So they're the type of symptoms that they may be looking out for. And like I say, it doesn't mean you've got prostate cancer, but it means you should probably get checked out. And if not, just for the fact that there may be some lifestyle measures you can take to help with those symptoms.
Absolutely. Fantastic. And well then, Mr. Haldar, I suppose, how does prostate cancer compare to other forms of cancer that might affect men?
Well, that's a good question. I mean, in terms of prostate cancer, one of the things to be aware of, it is certainly it's the most common cancer in men in the UK. About 27% of all cancers diagnosed in men in the UK will be prostate cancer. So in terms of comparison, it's certainly it's the most common. About in the UK, I think roughly about 52,000 men are diagnosed with prostate cancer every year, and that incidence seems to be has risen, and it seems the predictions are that it will continue to rise. The majority of men, unlike perhaps some of the other cancers, the majority of men who are diagnosed with prostate cancer will be elderly. So I think over a third will be over the age of 75. And so that's something to be aware of. And in terms of deaths, it's also very, although a lot of people believe that there's the old adage that you'll die with your prostate cancer, not because of it. The truth is that 12,000 men a year do die of prostate cancer. It's the second most common cause of death from male cancers in the UK. So it's certainly one to be aware of. And again, the majority of men who will pass away from prostate cancer will be elderly. So I think 75% will be over the age of 75. So that compared to some of the other cancers. But one bit of good news is that the death rates from prostate cancer in men who are diagnosed with prostate cancer has been falling and is projected to fall. And one of the reasons is that we're picking it up earlier, we're getting better at treating it. So absolutely, although it's becoming more common, if you do get diagnosed and you get diagnosed in a timely fashion, your chances of surviving it are much greater. And the statistics again show that 96% of men who are diagnosed with prostate cancer will be alive from their cancer a year later, and 86% will be alive from their cancer 5 years later. So certainly one to be aware of because it's very common, but it's also one to not hide away from.
Absolutely. And a lot of reassurance there, Mr. Haldar, for patients who might be diagnosed. Fantastic statistics to say that the chances of recovery are very, very high. And leading on to our last and final question, then, perhaps the most important one, Mr. Haldar, how is prostate cancer treated? And how do the new modern forms of treatment compare to previous ones? How effective is the up-to-date treatment?
Well, another good question, and obviously not. It's a lot of options that we would discuss with a patient that we couldn't possibly go through in a short interview like this. But the first thing to mention is that not everyone needs treatment, because there are a lot of prostate cancers that are low grade and would probably be very slow growing, and as the old adage says, you may be more likely to die or pass away of natural causes with your prostate cancer than because of your prostate cancer. So there will be some that won't require treatment, will just need close monitoring and possibly treatment in the future if necessary. So that's one thing to note, that just because you're diagnosed with prostate cancer doesn't necessarily mean you'll have to undergo any invasive treatment. Then if you do require treatment, it will really depend on a couple of things. One is obviously the extent or what we call the stage of the prostate cancer, whether it's confined to the prostate or whether there's signs of spread outside of the prostate. It will also depend on the level of aggressiveness of the prostate cancer, and we determine that by something called the grade of the prostate cancer. So when the pathologist looks at the cells under a microscope, they'll see how aggressive those changes are, and that will help us determine. So a low grade one, we may just observe, and a high grade one, we're more likely to want to hit hard with treatment. And it will also depend on the age and the fitness of the patient. So a younger patient with hopefully many more years ahead of them, we're more likely to want to be a bit more aggressive with the treatment than a patient who's in the later years or with significant other health problems, where those ones we're more likely to say, well, the prostate cancer is probably not your primary concern, and it's one that we can safely monitor. So there are various factors, but in terms of treatment, curative treatment, the two main forms of treatment are either surgery to remove the prostate cancer or radiation treatment. And there are various forms of surgery and various forms of radiotherapy that would be discussed with their pros and their cons and their potential side effects and potential benefits.
Fantastic. Well, Mr. Haldar, I really thank you for joining us at Top Doctors this morning to raise awareness in this Movember 2021 Men's Health Awareness Month. And well, thank you so much for your time, Mr. Haldar. And for anybody watching out there who would like more information about Mr. Haldar, about prostate cancer, if perhaps we're worried about some symptoms, you can check out Mr. Haldar's Top Doctors profile on topdoctors.co.uk. Thank you so much for joining us, Mr. Haldar.
Thank you, Connor. It was a real pleasure.